Good evening students, welcome back to our channel Ach'z. So sorry for the late update. It's about the OET exam review of 9th November 2024, the first test date for the OET, and we are going in detail about each and every skill, starting with the reading module. In the first set, part A was about eczema, paragraph A including the types of eczema, paragraph B about the risk factors, paragraph C zones based on the severity, and paragraph D management of eczema. So that's about the part A set. And in the C1 and C2 of the same set, C1 about the cholesterol management and C2 multiple sclerosis. So writer's attitude and opinion based questions were more, and also about the inference type of questions. Now coming towards the set 2, part A was about epistaxis, paragraph A including the definition and symptoms of epistaxis, paragraph B about the causes of nose bleeding, paragraph C treatment in children, and paragraph D about the preventive measures. In C1 and C2, asthma and TB medicines. So that's about the C1 and C2. Lexical references and inference type of questions were more. Now about the writing module, in first set, it was a non-case, letter to patient GP, patient name is Mr. Brook, non-case of prostate cancer, current problem is loss of appetite, lethargic and weakness, patient at emergency department and later got admitted, initial management, morphine 10 mg and nutritional management, investigation done, that is X-ray and MRI, and find out that these metastasis to the lumbar spine and lungs. Discuss the condition with the patient relatives about the end of life care. So we need to write a letter to the GP for the continuous care and management. So that's about the first set of letter. I hope you understood about the content. Fine. So now we will move towards the second set of letter. Again, non-case. It was a home visit. Letter to patient GP. So they given the current date. Non-case of pressure ulcer. Wound is getting healed. Current problem is rashes over upper chest, back and wrist area. Patient is doing self-management by applying some ointment. So patient is not ready to see the GP. So during the assessment, we find out that the rashes are severe and we need to convince the patient to see the doctor. So write a letter to the patient GP for proper assessment and management. So that's about the second set of writing. Now we will move on to the next skill, speaking. In the first cue card, it was about the mother and child. Child is not physically present. Child of a 7-year-old boy. Surgery done for eardrums. We need to explain the patient about the aftercare of the child because she is concerned about the same, about the bathing, medicine, school going, etc. So tactfully responds towards the question and convince her. So that's about the first role play card. Very minimal information they given in the card. And now coming towards the role play card 2, hospital ward, patient name Mrs. Taylor, 70-year-old lady, had a stroke and planned to discharge after 2 days. So the patient is concerned about aftercare. So the patient need an occupational and speech therapist. So we need to explain the need of the therapy and aftercare by clearing the concerns. So that's about the second role play card. I hope you understood about the content. Again, the information is very minimal. Now about the third role play card, mother and child again, 4-year-old child with the plaster cast. Explain the mother about the care of the cast, like keeping the cast away from dirt and sand, avoid getting it wet, care during bath, like seal the cast in a plastic bag with a tape or a rubber band, keep it away from direct heat, avoid bumping or heating the cast, take care about the child to do not paint or decorate the cast using any markers, and also about the follow-up visit to assess the complications. So that's about the third card. We need to explain each and every management and the care to the mother. Now coming towards the last module, listening. Set 1 including talk with a neurologist and talk with a gastroenterologist. Now coming towards the second set of listening. Talk with a neurologist again and talk with a rheumatologist. So that's about the entire review of the test day. So all the best for your results. Thank you. Stay tuned.